My name's Mariette Allen. I'm an assistant professor of neuroscience at the Mayo Clinic in Jacksonville, Florida, and I do research within the group of Dr. Nilufer Ertekin-Taner. I'm going to tell you today about our recent study published in Nature Scientific Data that describes an exciting resource that brings together genetic and genomic data with the goal of accelerating new discoveries towards developing therapies for Alzheimer's disease. Alzheimer's disease is the leading cause of dementia and affects more than 36 million people worldwide. Without the development of novel therapies, these numbers will continue to rise. To address this need, the National Institutes for Health has launched the Accelerating Medicines Partnership in Alzheimer's disease with the goal of accelerating new discoveries towards development of novel therapies. So our work is an important part of this partnership and brings together genetic and genomic data on more than 2,500 patient samples from subjects with Alzheimer's disease, other neurodegenerative conditions and controls, resulting in more than 800 million data points. So importantly, this data is being made available to qualified researchers, which is expected to enable the acceleration of new discoveries, leveraging this data towards the goal of developing new therapies for Alzheimer's disease. And the way that we can accomplish this is through the identification and gain of knowledge of genetic risk factors and also the molecular mechanisms that underlie the disease process. Using the data that we have generated and described in this report, we and other researchers can identify new therapeutic targets and also develop biomarkers to predict those at risk for disease. The importance for patients is that we expect this to accelerate the production of the identification and production of new therapies that can be brought from bench to bedside. So we continue to investigate our data using cutting-edge analysis approaches and building on to further investigations in model systems towards our goal of identifying novel therapeutic targets and developing therapies for Alzheimer's disease.